already mentioned most of the things I had to say, so I can just say thank you. uh, so let me present the perspective of a computer scientist that also came out quite well in Donna's slides. So first I'll talk a little bit about the process that I myself went through to engage the health researchers. So it was way back in 2006 as part of GEI program where I met Vivek and where I met Wendy. So in that there was a call to develop field deployable tools, and that's where I recruited a medical anthropologist, sports science researchers, psychologist, then Emre, who I continue to work with, and he's the one who builds all the sensors. He's an electrical engineer. Then a biomedical engineer who developed sensors for alcohol measurement. So that's the team built in 2006, and that was my first mobile health team. Then happened to meet Wendy at the GEI program, and she connected me to this wonderful team of mobile health researchers. Includes Donna, includes Susan, and a variety of amazing people. And so then I got access to a large group of very talented health researchers who formed the nucleus of my team when I went to put together a team for the MD2K Center. So that's the amazing team, many of whom came thanks to Wendy. So what did I learn from my experience over the past 9 years of recruiting a team of health researchers, working with them, and having concluded projects with them? So, so what I'll tell you is that this is not a science; it's an art, and there are different lessons at different steps along the way. I asked somebody when we became a fresh parent about advice, and what she had to say. She was a grandmother, and what she said is that I won't tell you that it gets any better; it gets different. So meaning that there will always be things to learn and adapt as you work with health researchers. So what I'm sharing are just my learnings as up to now, and this might change if you ask me a year later, and the same applies to you. So meaning what we are providing are just some data points for you to make decisions. Everybody's circumstances, situations are different. And so use whatever we are saying just as some more data points in your decision-making process, not a prescription. Some of this work for us doesn't mean that it will work for you, but may help inform your decision-making. So first is, so why should you work with health researchers? I don't think that you need that anymore. Otherwise, you wouldn't have applied to this mHealth Training Institute. So you are sold on that idea. Certainly improves your chances of funding success. It helps you address problems that can have a larger societal impact by being, so there are two aspects to it. One is that the problem that you pick itself will have a higher societal relevance because you're working with other disciplines who may be more connected to the society than we may be. And the solution you develop will have input from a variety of other disciplines that have a different way of thinking, and therefore it's greater chance that what you develop will not just remain on paper but may get adopted for societal relevance. And having that chance of societal impact is certainly something that drives many of us. So, and then another scientific benefit is that you could learn some methods and techniques from other disciplines, and that you may be able to apply to your own discipline. And sometimes that actually leads to an entirely new discipline. In computer science, many times some new graduate comes along who picks up another mathematical tool and then applies it, and everybody then sees the importance and then they begin to use it, right? And that's what makes their entire career. Similarly, somebody else, they first time learned cognitive science or behavioral science, and they started applying it to design better systems, and then they become a star in the human-computer interaction. So it's learning from other disciplines can also be scientifically beneficial for your own scientific career in your native discipline. So there are multiple benefits of working with health researchers. So recruiting collaborators. So I personally do not treat grant as, okay, that's going to give me funding and then it's going to help me improve my career and then I'm going to get my tenure promotion. But rather what excites me about the grants is that many of people in academia, they're extremely busy people. They are pulled in many different directions, and grant is one opportunity, one vehicle that I can get a share of their brain, that I get a chance to work with them, get to bounce off ideas, and hopefully work together for a long time. And that's what it is to me. Grant is basically an opportunity to work with smart people that I have always wanted to work with. So then the next step is, you identify the key expertise that you need. For that, it requires you to understand the other disciplines that you are going to work with sufficiently, at least that level that will help you identify what expertise do you need in the related disciplines that you're trying to recruit from. How do you recruit, or how did I recruit? So, sometimes I looked up and found this is the expertise I need, who is the best I can get in this discipline, make calls to them, just cold call, and I'll tell you as to why sometimes that may work, may not work. So, the benefit is that you have a wide net to recruit. Then there are obvious cons. You don't know how it is to work with such people. What's their personality like, and so it will be a wild card. Okay, but the first challenge itself is, if you make a cold call, will they agree to work with you, given that their time is 200% committed? If suppose they are in your social circles, as Vivek was saying, he likes to work at UCLA because you get to meet amazing people in so many different departments, so they become part of your social circle. So tomorrow if an opportunity comes up, you know your personality, you know you get along very well, and you know they are very talented people, so recruiting becomes much easier. So there is some benefit in stepping out of your office and joining for some of those parties or get-togethers. And then references, so recruiting from your connections. So you need such and such expertise. Can you find someone that you know who knows them? And that takes a little more effort, but that sometimes works. But whenever I go to recruit somebody, always in the back of my mind is, okay, the person I'm approaching, even if whether I know them or not, they are extremely busy people. So why should they work on this problem, either by cutting down one more hour from their sleep or from their family, or by declining another opportunity that comes their way? Those are the costs that they have to sacrifice to work with on this new project. So what's in it for them that justifies those sacrifices? So I really try to think very hard about it as to why is it going to help my collaborator to work on this project? Either that it caters to a passion they have, something that they have wanted to do but didn't have the right tools to do thus far, or that this provides a motivation or a chance to have a higher impact than they can have with other works that they are doing. So again, the obvious part is, of course I will help them get funding. They are overfunded anyway. So that's not what's going to motivate if you really are after bright people. So you really have to think beyond the obvious. So once you, so that's the recruitment process. So there is also a vetting process. Is it going to be a good match or not? So first, CS people or engineering people, they are all academics. So they are not, they don't have a company. They, more importantly, from their careers, for CS or engineering faculty, it's more important to ensure that the students who are the ones who do the work, their career is well served. And the students need their dissertation, which means that they need high quality papers out of the work that they are doing. So if they are going to be the ones working on a project, the first question I ask is, if I get involved in this project, is there opportunity or scope to have CS dissertations out of it? If the answer is no, then it will be a great injustice to my students to have them involved in this particular project. Remember, these are very extremely bright students who could have gone on to work for Facebook and Google or Yahoo or another startup and could become a millionaire, and they give up that opportunity to come and work with us. So it's our responsibility to ensure that we serve them well when they are at the most productive phase of their life. So again, that's an important question that every CS academic asks. So if as a health researchers you approach somebody, keep that in mind, that it shouldn't just be that they are providing a service, it must be that there is a scope for innovation in computing or engineering in the project that we are going to work together. Otherwise, it may sometimes be best to recommend a software company or to hire a programmer or a graduate. An ideal health collaborator for me is one who is willing to be the early adopter, the first adopter. If I give you an example, so today you carry mobile phones, right? think of the first prototype of the iPhone that was made. Would you be willing to use that for your benefit? We complain about finished products, that it doesn't work very well. But when it comes to working with a technologist, they are going to come up with the first prototype of something that may or may not work in the future. So if my health collaborator is not willing to be that first adopter, not just early adopter, not the one who will get the iPhone version 1, but the one who will get the iPhone version 0.1, right? Then they don't have the right mindset to be working with a technologist. For them, it may be better to wait until that technology matures, and then I think that this will be sold by a company who will be there to provide all the services. They will have the appropriate documentation, they'll have done all the testing, and that might make for much less frustrating project for them. And then somebody who has the desire to learn and treat all their collaborators as equal peers, not that, okay, I am such and such, and everybody else who is working with me are the ones who are providing service to me. They answer to me, and it's their responsibility to cater to me. But everybody is academic who should be treated equally with the same respect that you would like them to provide to you. And then third, who has the capacity and resources to learn or understand the new technology and do a project with this new technology that doesn't always work well, whose skills are not widely known, so they should be willing to pick up those new skills themselves, or at least their staff should be excited about it. The engagement process itself, you have to understand that, if you are recruiting either a technologist or you are, technologist recruiting a health researcher, you need to have some understanding of the other disciplines. If you are a technologist, then you need to have patience to learn these other disciplines, patience to develop a working system, not just you had a first prototype and you wrote a paper that only your students can work with, then it's a waste of time of your health collaborator. They need a working system that can be deployed in real life. So if you are not willing to go that extra step, the collaboration is not the right thing for you, and you are wasting time of your esteemed health researcher. And then the technologists, they should keep in mind, they are, again, as I was saying, they have to keep in mind the interest of their students. So only if they see a scope for their students to be able to publish high quality work in their native disciplines, only then their students will be able to get the right jobs, and you will get the new bright students to that discipline. So it's important for the entire mHealth discipline that we all are demonstrating the potential of this discipline to advance the careers of our respective junior colleagues and students. And then by doing this, you have to earn your collaborators' trust and faith. That means you have to deliver what you expect to deliver. You don't leave them at the doorstep. That means you take things all the way so that you deliver them something that they need and that they can work with in a timely fashion. And then the word spreads. So it's basically that's what will carry your reputation as to how impressed your colleagues are with you. And then in academia, it's a lot about credit. So I'm of the opinion that if you are generous in sharing credit, others might return the favor to you. If you watch out for yourself, the others will do the same. I'm trying to take the argument to extreme. So if suppose two people are running for office for the president of the United States, one says, oh, has been my lifelong dream to be the president. The other says, these are the problems I want to solve for the country. Who do you vote for? Right? So similarly, if you are working in a team and you are saying, okay, I'm looking out for my own interest and this is what I want out of it for myself, then it's the same, the others will do the same for you. And then the collaboration will fall apart. So you really have to be thinking about each other, what you can do and how you can facilitate and improve the other's life. And you have to be forgiving of others. There will be many mistakes made during this collaboration because as you are trying to learn each other, and you have to be forgiving and let go. We have to develop a shared terminology, have some expectations of who publishes what, where, whom, and when and with whom, who goes, what in terms of author order, and that's where I'm saying that you have to be generous in sharing credit. You shouldn't be afraid that, oh, I don't want to publish a paper that has 10 authors. Then again, don't go for collaborations. You can prove a theorem in a dark corner, and then you can have the paper just by yourself. And then finally, the research work should not conclude, as Donna was saying, as soon as you have your first paper. So again, I mean, if these are the things that appeal to you, please feel free to use them in your own collaborations. But again, tomorrow you might come up with ways, methods that may work best for all of us, and we'd be glad to hear about them. And if we can do all this, then we can create an mHealth community, and hopefully we all can contribute to improving the health and well-being and advanced science all at the same time. Thank you, and Donna and I can take questions.